Hi, I'm Matt Gloin. I'm a chiropractor at Live Well Chiropractic.
And I'm Dr. Alan Bonilla, also a chiropractor at Live Well Chiropractic, Los Angeles, California. You didn't know the topic. Today we're going to talk about how often should I go to a chiropractor? That's a question I hear a lot.
Yeah.
How do you answer that one?
Well, I answer it by first learning about the goals of the patient.
100%.
So I need to know what they're looking for when they come to see me. Then I have to examine them and figure out what the problem is. Some issues can be fixed real quick.
Mm-hmm.
Other issues I know just by the story that is coming out about how it's been going on for a long time or how the injury happened. I can predict about what care is.
Yeah.
But one of the things that I always tell patients is that, there is no long-term plan. There is a plan that has, I'm going to have to check in with that person after a short period of time to see how we're progressing with that care.
Totally. I think one of the most important things you said there was really trying to find out what the person wants.
Yeah.
I've heard of people having complaints before because someone was trying to, I guess, coerce them into having this particular pre-made plan. I almost think it's like if you go to a gym and you say, how often should I go to the gym? And you say, well, what do you want to get out of this? Because some people might just want to go to the gym once in a while to get rid of some stress, sweat it out, feel good, then you just go when you want. And I've had people that kind of treat us like that. They come in once in a while when they feel like they need it and they feel better and it helps them in their life. I'm totally fine with that. Other people might have a particular goal, and then in that case our experience is really helpful and we can generally tell what most people need to get there.
Yeah, and I like to be fair to people and be honest with them that there's certain things that it's unrealistic to think that one visit is going to resolve that issue. So if someone comes in with signs of a disc issue or they just had whiplash from some injury, I can give them a lot of education and information and some ideas about what they can do at home. But one visit just isn't going to do it in the same way that going to the gym once isn't going to do it.
Yeah.
But having that conversation together, we can figure out where you want to be, and I can, help best place you.
So I think the way you alluded it, you kind of said it, but the way to break it down would be kind of like finding out where you want to be, assessing where you're at, and then we kind of draw a bridge between those. A lot of times I tell people I want to make sure that they're going in the right direction, and sometimes we give them some leeway to the speed, meaning some people really just want to get on top of it, and they might actually set themselves a more aggressive care plan. And some people, maybe they have to navigate other things in their life, and so they might relax their care plan, and that's totally fine. I'm always going to give them the best recommendation, and there is, I think, some flexibility to that as long as we are making headway in a way that the person's happy with. I think you kind of are the same.
Yeah, and I think that there's people who come in who have real limitations, whether it's financially or through their insurance, time, family. They're visiting LA and they just need something. So I'll do absolutely as much as I can. And then if they have to get on a plane and fly home and they have to see someone else there, at least they got the information to make that next step.
A lot, actually.
Yeah.
So whatever, I think we both have this attitude, we just, we're going to give you the best recommendations, but whatever, real life is not always ideal, but you got to make it work.
Yep.
And a lot of times we do make it work. In fact, I think we often do.
Yeah.
So it's kind of, I hope that was a really helpful non-answer, because the truth is that it really does depend a lot on your circumstances and what we're working with. But like I said, the direction is really the important thing. Almost everyone, every visit's gonna be walking out if you're better than when they walked in, and that's, I think, really enlightening to know that you can reverse a lot of the health problems that sort of just come with time and age and trauma and such.
Yeah, and it all comes back to having that trusting relationship with the person that you're working with.
Absolutely.
If you have that trusting relationship, even if you're just starting and you have to come back to your care at a later point, or you're ready to get on board and do what's needed, then you're gonna feel comfortable knowing that person's there for you.
Yeah, we'll make sure of that. Sounds good?
Sounds good.
Cool. Anyways, thanks for watching, and we'll see you guys in the next video.